Bushey, and I come from Seattle, Washington, in the US. I was referred by my doctor to a urologist, and when I tried to book a urologist, they were booked out 3 months and longer. So I thought, okay, I'm going to come to India, let me try a urologist here. But I also wanted to have the UroLift procedure. And I started looking, and I came across Dr. Mohan Keshavamurthy and found that he was the first one in India, and Fortis Hospital is the only one in India to do UroLift procedure. And so I came to India. So in my case, I was having very great difficulty passing urine. And as I was trying to describe this to the doctor, they ran several tests for us. The tests they ran confirmed that it wasn't just my imagination. They actually quantified the problem in detail, and they were able to specifically determine what kind of problem I was having and that I was the right kind of candidate for a UroLift procedure. When I scheduled the surgery, it took only 1 day to get in and have it done. The surgery was completed within a matter of a few hours. Since then, I've had the procedure and I've had a number of tests, but they were all done rapidly in succession. Within a matter of a week, I had everything completed. Dr. Keshavamurthy and team were very good. I saw a number of the team members, and the nursing staff was very courteous and very kind to us. The hospital has a slogan that says, "We create hope where there is none." A very good hospital, very reputable. So we're very thankful and grateful for the service we received here at Fortis. I would recommend Fortis Hospital to any of my friends in the US. What was done for us here, we really feel blessed by coming here. Thank you.
Good afternoon. It's a pleasure to elucidate a successful case of minimal invasive management of benign enlargement of prostate. Mr. John is an American national settled in India for a long time, more than 3 decades. He had consulted many hospitals and urologists with difficulty in passing urine, as well as frequency and incomplete sense of void. He was on alpha blockers for over a decade. He was keen to undergo a minimal invasive procedure where his sexual function and ejaculatory function were not disturbed. From this perspective, after evaluation, we offered him the possibility of UroLift. Now, UroLift is a minimal invasive technique wherein pillars are inserted to push the prostatic tissue away. No formal resection of tissue is done. This helps in preventing retrograde ejaculation as well as preserving sexual function in men aged greater than 50 who have benign enlargement of prostate with significant lower urinary tract symptoms and would want to preserve their sexual function as well as ejaculatory function, yet pass urine freely without any significant post-ward residual urine. We offered this innovative technique of UroLift to Mr. John, and after prolonged and persuasive discussions regarding the pros and the cons of the procedure with both Mr. John and his wife, he decided to go ahead with the procedure. This required 7 pillars to be fired in view of the fact it was a large prostate over 80 grams. His post-operative recovery was smooth. He was able to pass urine with excellent uroflow with no post-void residual urine within 3 days after surgery. I was able to resume all activities of daily life just after discharge, which was a day and a half in the hospital. It was a clear-cut delineation of UroLift being a useful minimal invasive technique in those patients who intend to preserve their sexual and ejaculatory function and yet undergo an appropriate endoscopic management of benign enlargement of prostate. Thank you.